New Jersey moving into the next phase of its fight against COVID-19 today, with Governor Murphy holding his final in-person coronavirus briefing.
All right, Teresa Priolo live in the newsroom with how the Garden State is shifting its pandemic response to live with the virus. Teresa.
Stephen Laurie, 2 years to the day that the first case was detected in New Jersey, Governor Murphy lifted the public health emergency, and on Monday his mask mandate will end. A significant shift from an emergency to an endemic.
We have the whole band together for what we hope is a final encore.
It's the end of the beginning in New Jersey.
This anniversary is the right time for us to end these in-person briefings.
A transition out of COVID being a public health emergency and into an endemic illness that'll be with us for years to come.
I know you are exhausted both mentally and physically and ready to return to normal, and let there be no doubt, so are we.
Monday, New Jersey will lift its mask mandates for schools and daycares. The governor is also lifting the public health emergency. Some hospitals, like University Hospital in Newark or Centris State Medical Center in Freehold, have no infectious COVID patients.
It was a significant surge, but it came down just as quickly.
Statewide, the positivity rate is hovering around 3%. In some areas, it's 2%.
I caution people when we talk about this, it's not over. It is still out there. It's still potentially deadly. But I think the experience we've seen in the hospital now is a reflection of the success of the vaccination efforts.
In New Jersey alone, COVID has claimed more than 30,000 lives. At the height of the pandemic, when it was unsafe to gather together for funerals, Governor Murphy began memorializing victims at his daily briefings.
Marie, Anthony, and Roe are the final three.
Today, he closed the chapter on those as well.
We honor each and every single one. Hard to believe. Of the more than 30,000 lives we've lost. So for all of them, let's do one final moment of silence.
One thing to also mention, COVID numbers might be in free fall, but the head of Centris State Medical Center tells me they are seeing an uptick of depression, self-harm, and other mental health issues as a result of this pandemic and 2 years of basically isolation.
Those are very real problems for sure. All right, thanks, Teresa.